afternoon to you, and welcome to another episode of the Young Voices Forum. Today, our topic of discussion is assessing healthcare, the case of the deaf. We all have a right to healthcare, but irrespective of your gender, your class, or who you are. But it looks like when it comes to our brothers and sisters who are hearing impaired, it is a difficult case for them. So today our conversation is going to center on assessing health care, and we have three amazing people actually from the Association of the Deaf to join us in the studios today to do the discussion. Welcome.
Thank you very much.
Okay, so to start the conversation, kindly tell us about your association.
Yes, my name is Abdul Shakur, and I'm the president of the Association of the Deaf Northern Region Branch. I think our headquarters is in Accra, and we have 16 branches across the country. That is to say, in all the 16 regions. The association, yes, as I said, our mother organization or our headquarters is in Accra, and our main objective is to advocate for the rights of the hearing impaired or the deaf people in the country, especially in the area of communication. That is to say, the deaf are having a lot of problems. First, economic problem. Many of them are finding it difficult to gain employment to the public sector just because of their problem or their inability to use their mouth or ears to do the business of communication. Due to this, we are just coming together to advocate for the rights of these vulnerable people in the society. And as you rightly mentioned, the healthcare is a major factor. And I will, one time when we continue with this discussion, I will deliberate much on that.
Okay.
And I'm Abubakar Mariama, and I'm also a member of the association and also a gender representative for the Northern region. Yes, to say something about the association, it was formed in 1967, 68, and the head office is in Accra.
We have all 16 regions.
And we have branches, as my regional president said, in all the 16 regions, and we have sub-branches in all the districts in the country. Yes, and we also have a board, and we also have our regional executives and our vision, our objectives and targets and goals and objectives. As a Northern Region Association of the Deaf is to, our target is to develop the life of the deaf in the area of education, women, young and healthcare issues and interpretation and deaf employment. That is the main objectives of the association. And the membership is about 110 in the region.
We have 500 men for the people in Ghana.
We have about 500 deaf men in the country.
And 400 deaf women.
And 400 deaf women in the country.
We have a Savile school for the deaf school in the region.
And we have Savile school for the deaf, who serve as the only school for the hearing impaired in the region. That is to say, Northern region. And our target is what? How to teach the deaf to be able to care for themselves very well in the society.
Also, our national office, it is going to have to get healthy to station.
And also, our head office in Accra also took it upon themselves to educate the deaf girl about their menstrual cycle. This is a project which is ongoing. And these are the little activities we are embarking on.
Thank you.
For now, I will leave it here.
Okay. Thank you very much for telling us about your association.
Wow.
So moving on, I want to know, how important is healthcare to you?
Healthcare is very, very important to us, especially we as a woman, especially the young women. Taking into consideration our special needs. You know, men don't take sometimes their healthcare serious to some large extent, but we, the ladies, our healthcare is very, very important, because whether we like it or not, one way or the other, we will visit the hospital. And our main challenge about healthcare or accessing healthcare in the country or the northern region is communication barrier. Lack, that is to say, example, a young grown woman in a family, you must know how to care for your menstruation, the basic needs of how to cater for yourself. Because of lack of communication, the parents find it difficult to teach them, do this, clean this when it is coming, do that and do that. So that is to say, it is always very difficult for the deaf girl or child, a deaf lady, to be able to cater for his menstruation very well. Now let me continue to pregnancy, especially safe abortion. Many of the deaf girls don't even know where to go and access abortion service whenever the need arises. Which hospital, which doctor? For an example, the whole of the northern region, look at the big facility standing there we call regional hospital. It is not having a sign language interpreter. Compare that to the other regions. That is not the same. They will go to the hospital and there's no sign language interpreter, OPD, meeting when they are going to the doctor's office. There's no one to communicate, help them in the communication. They will go and they give them pen and papers to do right, to start writing, and that is not their language. They have a method of communication, and there are people who support them in this kind of communication. That is why I am always taking it upon myself when the need or opportunity bring itself, like this forum you provided for me, to tell the health care providers that we need a sign language interpreter at the Tamale Regional Hospital. It is a must. So that it will be very easy for us to also access healthcare without any fear or hesitation in Ghana.
Thank you.
Thank you very much. I would like to also add something small about healthcare. In fact, healthcare is very important to the deaf community or every individual, because yes, many information about health care, we the deaf don't have access to it, because it is normal put in a speaking or a talk show where they go around in a car or a pickup going around giving information, forgetting that there are people in the society who cannot access that kind of information. Sometimes some of us, our parents, will hear one or two things on the radio, on television, and try to explain it to us. But it is always difficult, because these parents of ours also find it difficult to communicate to us. Though they are our parents, but it is very, very difficult. So we have been challenging them, not only them providing us sign language interpreters, they should also, part of the staff over there should also learn the language. When they learn the language and we come, they will be able to at least do basic sign language for them to just know the reason why we are there first and foremost before we continue to wherever we may be going. Now we are having a program about mental health challenges among the deaf. And since about quite a long time ago, the country has been talking about mental health, forgetting that among the deaf, there are other people among them who are also challenged with their mental health. But no one cares to listen or hear from them. The government is focused on only the hearing public. Sometimes the schools, look, we need a lot of sign language interpreters to provide us basic service, not only in the hospital, madam. We need sign language interpreters at the court, schools, and in the hospital too. In fact, if these interpreters are provided, life will be very, very meaningful for us too. In America, I want to always share their examples to our situation, or compare their situation to our situation. Over there, every sector you enter, even if there is no sign language interpreter in that department, it is because many or half of the staff can communicate very well in sign language. That is why there is no anyone sitting there as a sign language interpreter. Many years ago, deaf healthcare, no one was talking about it until our headquarters took it upon themselves to start advocating about it. They sing a lot of songs before people started listening to them. I think the first project we have was to look at their reproductive health, which was a very major challenge for them. And the money they have for that project was very, very limited, as you can see how it demonstrated with very, very limited resources. And due to that, it couldn't go far because many of them are in the districts and in the villages. And it only took in the capital and many of the capital regions. Apart from that, other districts couldn't benefit from that project because of lack of funding. Okay.
So when you go to the hospital,
when you go to the hospital,
how are you treated?
How? The nurses, doctors treat you. How? Yeah. When a deaf go to the hospital, the doctors don't care about us. They just don't care at all. The nurses don't care. Some of them will make amends to try communicating with us, and they will, and before you see, they'll start laughing at you. At the end of the day, wrong diagnosis leading to the wrong medication, and they will give you a medicine which will worsen your situation. An interpreter would that help. An interpreter would that help. You remember Abdallah case? When the medicine they gave him was to what? Chew. But he was swallowing the medicine. And it was a BP medicine. Until he went with me to the hospital and for a review. And the doctor was asking him, so are you been taking this medicine, this one, and that? And you remember this one? I said what? You should chew, not swallow. He said, because you said, I was just taking it. I never chew any of it. These are the problems I'm talking about. Lack of communication. Sometimes they write, and the kind of, especially the English the doctors write, I would say even my members, our English is somehow better than them. They will write it down for you, and you don't know where to even start reading. And they demand that you should read and understand what they are saying. 2018. Yes. In Ghana, research showed that about 37.8 of them passed on because of wrong medication they took from hospitals, just because there was a wrong diagnosis, because of lack of communication. In fact, if government, due to this, now many of us don't like going to the hospital. They prefer accessing the local or traditional medicines than going to the hospital. Yes, and I am boldly or very, very rest assured that if a sign language interpreter is provided at the hospital, I know my members will access the hospital day in, day out. But because of lack of interpreter, that is why we are not coming. Last, one of my members named Habiba, she was sick and she wanted to go to the hospital, but because of lack of sign language interpreter, she decided not to go to the hospital because she didn't want to go there and they provide her with a pen and paper to write. And when she write her English, they will be laughing at it. She was hiding in a room until she passed on. But yeah, she died 2018. Yes, and sometimes too, when they just realize that we are one of them, deaf, everybody will just turn their attention to elsewhere and just leave us to ourselves to do whatever we can do there and leave. Sometimes we feel very, very disappointed and we leave there quietly without us doing whatever we came there to do or we go there to do. This is the little that I have for now. I would like to add something.
Look, our woman issue at hospital.
About our. I want to focus on the woman, especially the girl child. For example, every woman needs privacy. Sure.
For example, a woman, it's not every man discuss with.
Yes, I'm a woman. There is not everything I can discuss with a male interpreter because it have health issue. I'm a man and she's a woman. So if I go to a hospital with him privately because there's no one there, I am forced to go with him, and there's some private issues I wouldn't want him to know about me, but I'm forced to discuss it with him because he volunteered to help me. I have no option than to open up to him. In fact, due to that, I always encourage the nurse girls or ladies to try and learn the language, which is very, very easy to learn.
It's not everything about interpretation.
It's not anything about interpretation. The staff there can learn. Nurses' daughters can learn how to communicate with the deaf. Now look at it in this way. Now I'm pregnant and I'm now I'm pregnant and I'm going for antenatal care. Does it mean that I have to every month get a sign language interpreter who will volunteer to go with me?
I can tell somebody has to go with me.
Right? Should I be taking somebody's husband to the hospital day in, day out without any remunerations?
Time for giving birth.
Now time for giving birth in the labor room. Push. Push. I am a deaf. I cannot hear push. If you are commanding me push, how am I going to push?
I'm going for safe abortion.
Now, if I'm going for safe abortion, it is a private matter.
How to cope?
Now, when I go, who am I going to communicate with them? Who am I going to have? To live with me, the center needs to look at this issue very seriously, to see how best we can bring in the government, the NGOs, everybody who we think can come together to curtail this situation, to see how best we can find a lasting solution to this problem. Thank you.
Okay, so if you just joined us, this is the Young Voices Forum, and today we are discussing how the deaf access healthcare. And so far they've been saying a lot of things that I find very, very, very overwhelming, and there is a need for us to do better. So if you have any questions or any comments, you can just leave them in the comment section and then I would read them. But I have two. Ethel says, I can imagine how difficult it will be for parents of children who are deaf. How do we support you? Isan also says, in the absence of a translator at a healthcare facility, how do you expect them to access the care they need? So let's move on to support. Ethel is asking that what are some of the things that we can do to support you at the health center?
Support you. First of all, sign language interpreted. First of all, sign language interpreted. It will make our work very easier. Secondly, to add to what my president is saying, I will love some of the staff at the hospital. Every department, I learned they are having different departments. To get 2 of their staffs in that department to learn basic sign language, so that when we come to the hospital, they will tell us where to go and have somebody who can communicate with us and who can take us all over, anywhere we want to go to the around the house, any place we want to go in the hospital, we can go with that fellow, and the fellow can provide us with the help we are looking for.
Okay. Also, I have another comment from Rahina that says the situation seems more gloomy than we thought. Yes, the situation is really gloomy. So if you also have any comments or questions that you want to ask, you can leave them in the comment section. So I want us to make a list right now. Right now, I want us to think of 5 things that, if implemented, could improve your experience at the health facility.
Okay. 5 things. First of all, training of the nurses and some of the doctors in the language. Secondly, deaf education. Many of them don't know anything about us. Thirdly, deaf employment. We also need some employment at the hospitals, like cleaners and what have you. It will help. I'm very, very much interested in employment, so he can't talk anything about adding the employment. That's okay. And if her sister can add, she give 3, you add 2. I think government should come up with a policy that will cater for the health needs of the deaf. That is to say, it should make it mandatory for the nurses, the doctors to learn the sign language. It is lastly,
make it as a rule for them. Don't get on one to know it and
yes. Also, I will be very glad if, especially when we are pregnancy and when we are having or we want to do a self-abortion, there should be some indicators at the hospital to just direct us, posters like that, to just direct us, pass here, go here, and meet this kind of person. He or she can take care of your problem.
Okay, so their final words, and then we wrap up the conversation.
Final words, so that we close.
Thank you.
Really, thank you. Add something. Okay. Yes, I am very, very happy with a lady here called Rihanna. Yeah, who is a staff who always try to communicate with me. Yes, we met once and we become friends, and always she's trying to hear our side of the story and see how best she can, bring in policy makers to see how best they can help save our situation. And I'm very glad to meet her, and I want to say a very big thank you to her and all her team members and all of you. I'm very grateful. But not only at least the healthcare is our challenge, we also have employment challenges and educational challenges. Many of my members complete SS and they have a very good grades where they have financial difficulties to continue to tertiary institutions. These are all our challenges, and as a leader, I would like to have some remedies for that. In fact, we also have a lot of deaf girl child in the schools, in the deaf schools. That is a local school for the deaf. So, in fact, we also have our association. This like the women's are more than the men. So it will be very good if we can, visit sometimes the schools to give them some basic education about how best they can cater for themselves, especially in the area of menstruation. They are young girls there, and they don't know anything about that. The parents cannot communicate with them, not to talk of explaining to them or teaching them how to take good care of themselves in that area. And lastly, safe abortion. They are there and they are doing their lovey. It can happen that one or two will become pregnant and want to go through abortion because he or she want to continue her education. How can she access quality and safe abortion? These children over there need that kind of education. This will be my last words. Thank you very much.
Okay, thank you very much, Madam Mariam and Mr. Mohammed. I am so grateful that you made time to be here today. I am sure that people are listening, people have heard. I cannot sit here and make any promises, but I'm sure that all of the discussions that we have had here today would somehow have some impact. And also thank you to everyone who tuned in to watch us today. Today the conversation has been very, 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 very overwhelming. I think that today we've all been forced to acknowledge our privilege, because each and every one of us, we are collectively responsible for people like us. They are all citizens of the country, and they deserve to enjoy all the rights that we are enjoying. And I think the most painful part for me today was about hearing them say that when they go to the hospital, and sometimes they even try to write, because the English is not correct in their own eyes, they even tend to laugh at them. So that makes it they become hesitant to even access health care, because they know that if they go and they write, they would laugh. And because of this, someone lost their life because he didn't want to go to the health facility and get mocked. So we all have a responsibility to ensure that they feel safe, they feel heard, and they feel seen. Today, I hope that we all acknowledge our privilege, and moving forward, try to do better to have them exist in the spaces that we all share. So until we come your way same time next week, my name is Rahel, and I'm being your host for today. Bye.